All right, Dr. Park. So the big news of the day is the increasing virus cases in San Joaquin County. Uh, I was just taking a look back in the data. If you go back to, I think, June 17 and calculate it to right now, that's what, maybe 53% of the total cases you got in San Joaquin County happened in 2 weeks. So what's
Yeah.
going on?
Yeah, you're absolutely right. Between June 14 to June 21, we had a 50% increase. And if you look at the entire month of June, there are more COVID positive confirmed cases in that 1 month alone than from the beginning of this epidemic here in San Joaquin. So what's going on is that we're seeing a very rapid rise in the number of our total case count, and it's quite concerning.
Now, I don't know what the efficiency of the contact tracers is in San Joaquin County, but have you guys been able to track back to what is causing all these increases?
We're doing our best to track back cases, and it's getting a little bit harder to do the more cases we get. Because we're getting so many, we're at a rate where we're getting about 200 new cases a day now. But the tracing that we have done shows that really most of it is going back to gatherings. So I know that I hear Sacramento talk about the same thing, and I hear my neighboring counties talk about gatherings, and it's true. It's the same here in San Joaquin. A lot of people are having birthday parties or leaving the county for a birthday party. Um, you know, graduation ceremonies were happening. There's some gatherings at funerals, and we've been able to track back a lot of things to just families and friends getting together. So that really is number one, when we can track back. And a lot of the times we just can't track back to anything definitive. And that's the majority of cases, is that they're just community acquired. So it's just out there, it's in the community.
So I know we've had multiple communities tell us that yes, in-home gatherings are playing the biggest part in this.
Mm-hmm.
But our comment section, every other person is saying, well, hey, there was a big protest back in the end of May, early June. Are we trying to say that this didn't play a factor in anything?
It might have played a factor, but it's hard to really pinpoint that as a definitive factor. We have not traced back any particular outbreak to one event or protest that occurred here in San Joaquin. People are out and about more, and I guess protest is part of being out and about more. But as far as actual definitive tracing back to a protest, we haven't been able to do that.
And I want to go back to what you were talking about with, well, you had mentioned Sacramento County, and I think this is one of the hardest things for me to understand. Sacramento County has 1.5 million people. San Joaquin County has 750,000 people. But San Joaquin County has a bigger issue with the virus right now, in terms of cases, than Sacramento County has right now. I cannot comprehend how that is the case right now. How does that make sense?
Well, we have some reasons that we think that that's the case. We are a mixed county with a lot of urban areas, but still a lot of rural areas. So we have some disparities there built in because of the geographic nature of our counties. We're just not as urban as Sacramento, and some people in our county have a more difficult time accessing health care or even getting to health care in a timely manner. So we do know that a lot of our constituents sometimes wait until they're a little bit sicker before they actually present to health care, and that's unfortunate because by then they've been out and about in the community transmitting and spreading COVID. In addition to that, we're just really agriculturally a busier county. We have a lot of farming here, and so does the entire Central Valley. So if you look up and down the Central Valley, it's one of the reasons why we think we're more hard hit. We have a lot of migrant farm workers moving around, and these people are essential to the economy and essential to food production for the entire nation. But we do know that they carpool to work, and they live in housing units together in very close quarters and large groups. So that's one contributing factor. It's not contributing to the entire case count, but ag in the Central Valley is one of the things that makes us different from Sacramento.
And does that tie into how we're seeing the Hispanic and Latino population being, pretty well impacted by this virus, more so than some of the other ethnicities?
Yeah, it definitely ties into that community. In the last few weeks, we've seen a significant rise in our Hispanic population, um, whereas before it was pretty evenly spread across ethnicities. We're now seeing that 60% of our cases, 60 to 70% of new cases are within the Hispanic community. So we're really trying to analyze the data and figure out where that's coming from and to target that population. But part of it is tied into the farm worker industry, there many of these people have been essential workers since the beginning and have not stopped working through this entire crisis.
So on that note, okay, we see the trend, we see some of the issues going on there. Well, if we see all those right now, what do we do about it to make sure that those virus cases don't keep impacting the Hispanic population so disproportionately?
So that's a good question because, as I said, we're trying to figure out what we can do and how do we get to this population with appropriate messaging that's going to be socially and culturally appropriate. We're trying to reach them in places where they're going to be more apt to listen, Spanish radio, Spanish TV. And we've done some studies analyzing the behavior of the Latino population. What we're finding is very interesting. They're a very loving community, and I think sometimes when we interview them, we find that they don't think it's proper to have a mask on when you're about to greet a loved one or a family member. And it's not to put labels on people because a lot of them are actually really following the rules of social distancing and they're really masking and washing their hands. But and what we're finding is that on top of that, they have not stopped doing the gatherings. And I think maybe we need to talk to this population more about how, even if you are distancing yourself in the supermarket and distancing yourself in public, you're also supposed to distance yourself from people you don't live with. And that's a hard message to deliver when so many people are wanting to see their relatives and friends in household gatherings.
So a bit of a tangent question right now. When we talk about the increasing number of coronavirus cases, we started the reopening of the economy a while ago. And, I would think, just as an outside viewer, okay, you have more people intermingling, you would expect cases to just naturally go up. So
Mm-hmm.
I guess if this was kind of an expected result, what about it is supposed to be so jarring or so alarming right now?
And I think when the governor started reopening the state, everyone was expecting numbers to go up naturally because people would just be out and about more. But it was kind of like an experiment to see which counties would do okay and which counties wouldn't be able to handle it. And unfortunately, we're not doing such a great job with our reopening. And it's because we're just very populous and got a lot of young people out there. So yeah, we were expecting the numbers to go up, and we were not hoping for them to go up as rapidly as they have. And so now we're being asked to slow down again, and that all makes sense. So it's just constant analyzing of the data and looking to see what we can do to go back and make sure that our curve stays flattened.
So, you've heard most of my questions right now, but one of the things I'm wondering right now is, as the public health officer for San Joaquin County, what questions do you have right now, looking forward to the next few weeks, next few months?
Well, there's a lot of questions on my mind, and I wish I could predict the future. But what I'm going to be, wondering about is how are we going to be doing in a few weeks? The governor has just asked us to shut down some more sectors and wait for 3 weeks and see how it pans out. And so that's the biggest question on my mind is the public going to listen? And I'm really pleading that the public listens. You all kind of know what's open and what's not supposed to be open, and please follow the rules and stay home as much as you can. And if you want to go out for essential needs, make sure you're going out to a business that is actually allowed to be open. Because that's what my question is how many people are going to really try to get our numbers back down, and what are our numbers going to look like in a few weeks? I don't know. It's my biggest concern, because around that same time, we're going to start getting some flu, and we're going to start getting kids going back to school, and a lot of it's going to be happening at once. And that is what's weighing on my mind right now the most.
And, just touching back on what you mentioned about the governor, to show my hand entirely here, I did not think things would go that far. I could have predicted the bars. I could have predicted the bars closing again. But to see indoor dining, indoor restaurants, movie theaters, all this stuff, and all the regulations that just came out, to see that just backtrack so quickly, it really came as unexpected to me. So my question for you is, realistically, how far could this actually go in terms of backtracking?
In terms of reclosing, you mean? How far back could we go for closing things?
Yes.
Well, I don't think that the governor or I or anybody in public health has a clear answer to how far back we can go at this point, because we're constantly looking to see how bad things can get. I don't think we're going to go all the way back to stage 1. Hopefully not. And so there might be continuous partial closures here and there. As we saw, restaurants aren't completely closed. It's the indoor dining that's closed. So maybe we'll do some more partial maneuvering week by week as things go by. But I'm hoping we never go back to where we're fully back to a total shutdown.
That wraps it up for all my questions, but I want to toss it back to you. Is there anything else you think that's important to mention? Anything that is still in your mind that you didn't get a chance to mention? Please feel free to mention it.
Well, thank you for asking that. So, I look at our data and I think, did I expect our numbers to be this bad with each time that I reopened something? And honestly, no. I didn't think we'd have the growth in COVID case counts that we have now. And it's unfortunate. But what I really want to tell the public is, I don't think this would have happened if everyone had been following the rules, honestly. There's so many people out there who have been doing their best to really keep us on that flattened curve, and I commend them, and I thank the public for doing their best. And I know that there's a lot of confusion out there about what the rules may be, but as much as you can, learn them and follow them. And I think if we all really make a concerted effort this time around, we won't have to go back to full-on closures as we had before.